we have to be seen as agents of change.
Look, there's a real recognition that we have to prepare leaders for the world as it will be, not as it is. And there are certainly great minds who are saying that in the West in particular, we're entering an era of scarcity. Health economists, business leaders are saying, that we may not have the resources, we may not have even the financing to actually deliver what we've done in the past. And COVID's just compounded that. So in the words of someone like Thomas Kuhn, I think we might be facing a revolution rather than an evolution in how we deliver healthcare.
We haven't done, I think, a good enough job about making sure that the training in our universities and vocational training places match the demands of the sector. That really needs addressing. An example was the new Curtin Medical School that opened, a few years ago. I mean, people said we don't need any more doctors. Well, we actually do, and we're lucky that we started that 10 years ago. So it's a pipeline. It takes a long time sometimes to prime it, but there are going to be ongoing challenges in this space.
I think the most significant at this time is obviously workforce. We have a real gap in terms of skilled workforce, but also the unskilled labour market who are moving into different industries because it's not really competitive in aged care. We then have the issue of consumer choice because as we age, we're all wanting different things and demanding it of our both healthcare and aged care services.
For Aboriginal communities living in remote and rural Australia, these challenges that we see are due to the geographical spread because we are a long way from many of the health services from the metropolitan areas. We see many challenges here in the cost of delivering services out to our communities and out to our regions. And we also see that many of our communities are taken away, many of our people are taken away from communities, and that creates many other issues in being able to access high quality care in the metropolitan area.
So we've had a whole raft of variation across New Zealand. 20 different district health boards meant we did lots of things 20 different ways. And what we're hoping to do is that we will reduce variation. So we will take the best of breed and actually be able to provide a better service to all of the population, but we'll also be able to join up the services so people will have better access to the same high quality care regardless of where they live. So there's a whole raft of advantages we're looking to build on and the opportunities we think are significant.